Hey, this video will be an introduction to ADHD, Attention Deficit Hyperactive Disorder. How to diagnose it, how to treat it, what it is. One keynote, we'll kind of be going off both DSM-IV and DSM-V definitions. If you don't know what the DSM is, don't worry about it, it's not a big deal. Attention Deficit Hyperactivity Disorder is something that you see manifest in kids. It has to be before 12 years old in the DSM-V or before 7 years old in the DSM-IV. In any case, it happens in kids. So this isn't something that we see pop up typically, like in teenagers. This is something that has to have been going on for a while. And it's not something that just pops up in adults. So if you have an adult friend who said they just developed ADHD last year, be skeptical. But so what is it? Well, the symptoms of it are increased activity and impulsivity. And just think about the name: attention deficit and hyperactivity. So you're going to see these people fidgeting, not being able to be quiet. These kids, they will just be talking and just jammering and talking. You'll try and get them to be quiet, and they'll sit there, and you can tell that they just cannot be quiet. And less than 10 seconds later, they will be talking again. Their legs will be going. It looks almost like a restless leg. You look over, and you'll just see parts of their body moving, fidgeting. In an exam room, they'll be underneath the exam table. Then they'll be up on a chair. Then they'll be on their mom's lap. Then they'll be all over the place. Another key part of the diagnostic criteria for this disorder is it has to happen in different environments. It's like it happens at home and it happens at school. So this isn't just like, some environmental stressor where the kid gets to school and can't pay attention. So at school they're really hyperactive, but then when they get home, they're just an angel. That's not how it works. It needs to be in multiple settings, almost universal. Usually how we diagnose this, or at least the first step, is we have these questionnaires, and there are different types of questionnaires. I don't want to promote a certain one, but you can look them up online. Some of them you have to pay for, but usually what we do is we distribute these questionnaires to the parents and to the child's teachers or guardians, and they fill them out, and then it gives you this index score, and you can talk about hyperactivity, and you can use those scores as a baseline for how they're changing depending on treatment or behavior modification, that sort of thing. But we look for these hyperactive symptoms. We look for what the patient's history is, and if this has been something that's going on for a while, if it started before age 7 or age 12, somewhere in there. Another interesting thing about these kids is that they actually have a normal intelligence level. So a lot of times these kids won't perform well in school, and then people will think they have some sort of intellectual disability or mental handicap. Rather, they're actually smart or kids of normal intelligence. They just can't behave enough to perform well in school, and that's why it's important to get them on treatment and maintain their treatment. Interesting fact about ADHD is that 50% of children, roughly 50% of children diagnosed with it, will maintain it into adulthood. So this isn't something, a lot of people ask, like, well, why is it that is this a new thing? Is this like, an autism thing? Is this just seen in kids? I mean, what's going on? Why don't we see a bunch of adults with it? And the truth of the matter is we think it's underdiagnosed in the adult population, and that a lot of adults actually have this, and it's just an underdiagnosed thing. And like that fact says, about 50% of the kids diagnosed with this will maintain it into adulthood. If you really want to get into a diagnostic criterion, which we don't really do, you usually can see decreased frontal lobe volume in the brain. Decreased volume and metabolism. Usually we don't get that far. Usually it's more of a clinical diagnosis that we just see these questionnaires. Everyone, the teacher, the parent, and the provider are all kind of on board thinking that this person has some sort of hyperactivity disorder, and that's usually enough to make the diagnosis. And then really, another part of that clinical diagnosis is upon treatment, are the symptoms better? Is the patient better? And that treatment usually is in the form of central nervous system stimulants. So this is where you've heard of things like methylphenidate, also known as Ritalin, or amphetamines, which you might know of as Adderall. Those are stimulants. So those are things that ramp you up. And it's kind of like, man, why do we want to make someone who's already hyperactive, why do we want to ramp them up? Well, actually, if you stimulate the central nervous system, you actually can get that person to almost calm down, paradoxically, and get them to focus. And that's kind of the way to think about it, is if you stimulate that central nervous system, you're increasing their focus and allows them really to tune in and follow along with what's going on at school or at home. There are some side effects with CNS stimulants, as you might guess. These people aren't going to be very hungry, and these people won't go to bed. So a lot of times we really got to work around and titrate the dose of the medication so that we give it to the patient maybe when they wake up, and then hopefully, by the time that they get home and they're getting ready for bed, the dose is wearing off so they actually go to sleep at night. Obviously, then that means that there might be some behavioral issues before they go to bed as the medicine wears off, but again, that's something you got to titrate. There are immediate release and suspended release forms of medication. That's just something the provider's got to work out. It's based on the patient, how big the patient is, what they need, that sort of thing. And then kind of there's a new second line treatment that if those first line stimulants don't work, it's called atomoxetine. And this is kind of a new drug. It also goes by the name Strattera, which is probably what you've heard of. But that's kind of a new one that's working wonders. A lot of people really like it, especially if the stimulants aren't working or if there's side effects they just can't handle. But yeah, if you think that your child or a child that you're treating has ADHD, the first step, do a Google search for ADHD questionnaires. Get one of those diagnostic questionnaires. Again, I don't want to promote a certain one because some of them cost money, and distribute them to the parents and the teachers. Get them to fill it out, take those scores down, and go from there. Hopefully with treatment they should get better, which then confirms your clinical diagnosis. That's ADHD. Thanks.